Hi everyone! Today, in under 10 minutes, I will explain everything about ketamine. This is anesthesia in very few words. Surely you remember that famous case of 13 boys that got trapped inside a cave in Thailand. Well, the thing is, they had to put them to sleep so that they could be taken out of that cave by scuba divers. We're talking about being asleep underwater for 6 hours. This was possible thanks to an anesthesiologist who was also a diver named Richard Harris, who used ketamine. In 1962, while Russia and the United States were deciding whether they would blow us up with their missiles, Dr. Calvin Stevens was discovering ketamine. Ketamine has two different chemical structures or isomers, the S and the R variable. Both act the same way, but the S variable is more potent and has fewer adverse reactions. Still, this S form is very new, and it's not completely in the global market yet. What makes ketamine so special is the fact that it's both a sleep inducer and an analgesic agent. And its most important effect is known as dissociative anesthesia, which simply means that it will depress activity in a certain area of the nervous system and it will stimulate activity in another one. It will depress the activity from the cortex and the thalamus, which are the main areas where we associate thoughts, ideas, and stimulus. This is where thoughts become thoughts. At the same time, it will stimulate the limbic system, which is the center of the emotions and plays an important role in keeping us alert. The result is a patient in a hypnosis state who cannot feel pain or stimulus, but will remain with eyes open, presenting nystagmus and preserving corneal reflex and coughing and swallowing mechanism, although there is no guarantee that the patient can fully protect its airway at this point. When we administer ketamine and enters the bloodstream, it doesn't bind to proteins that much. But it's highly fat-soluble and therefore has a high distribution volume, which means that it will have a wide and fast distribution throughout the body, going first to the highly perfused organs, such as brain, liver, heart, and kidneys. And then it will go to the less perfused organs like muscle, skin, and fat tissue. From the very moment ketamine enters the bloodstream, it will take 15 to 30 seconds to reach the brain, where it will accumulate until its peak of action in about 1 to 3 minutes. Once in the brain, we have these receptors called NMDA that are widely distributed throughout the entire nervous system. We can find them more specifically in the union gap between two neurons. Its job is to convey information about nervous stimulus, particularly painful stimulus. These NMDA receptors are ionotropic, which means that they have an ion channel inside to allow different ions to go through and produce effects, such as sodium, potassium, etc. And its structure is formed by 4 subunits that generally are 2 on R1 and 2 on R2. In order to be activated and convey the nervous impulse or stimulus, these receptors need of a neurotransmitter called glutamate, which is the most abundant excitatory neurotransmitter in the body. And they also need an amino acid called glycine. Together, glutamate and glycine will bind to the NR1 subunits and will open the ion channel. This allows sodium and calcium to go inside the neuron and potassium to exit the neuron. Sodium and calcium will favor membrane depolarization, which means activation of the impulse transmission from one neuron to the other. Ketamine is an NMDA receptor inhibitor, so it will block its action. To achieve this, ketamine will get inside the ion channel of the receptor and block the sodium and calcium influx, and like this, avoids the nervous stimulus transmission. Therefore, the painful stimulus gets blocked and we don't feel pain. Ketamine is also an opioid receptor agonist, which means that it will stimulate and activate them. This is for sigma receptors and a bit less for mu receptors, which contributes to the analgesic mechanism. Well, now that we covered the principal and most important effects, which is in the nervous central system, let's see where else ketamine will act. In the cardiovascular system, we know that catecholamines are molecules that increase arterial blood pressure and heart rate. Ketamine causes catecholamines to accumulate, resulting in a positive stimulation of the cardiovascular system with increase of both arterial blood pressure and heart rate. This is why ketamine is a safe drug to use in patients that could be hypertensive or have a heart condition, except for ischemia. But if the patient is in shock and has depleted its catecholamine reserve, ketamine won't have catecholamines to accumulate, and therefore this positive effect will not exist, resulting in a decrease of both blood pressure and heart rate. In the respiratory system, it will be very rare to observe apnea resulting of a ketamine dose. This could only happen if we're talking of a very high dose and administered in a fast bolus. A big benefit is its smooth muscle relaxing properties, so it will cause bronchodilation, becoming very useful in patients with asthma or bronchial hyperactivity. A precaution is to be taken regarding saliva production, because ketamine will increase it, and it could elevate the risk of airway obstruction. But this can be prevented or treated with drugs that inhibit secretions called antisialaga drugs, such as atropine or glycopyrrolate. Ketamine will continue its route through the muscles, skin, and fat tissue, where we see no major effects, and then it will be time for it to exit the body. In order to do this, it has to start the way back to the plasma. By doing this return, it will go through the liver, where it will be metabolized in two compounds, which are less active and potent, called norketamine and hydroxynorketamine. These are water-soluble, so it will be easier for them to reach the kidney and be eliminated. If kidneys are healthy, elimination will occur in about 2 to 3 hours because its clearance rate is high. There are many commercial presentations for ketamine, but this is the most common one. A vial of 500 milligrams in a volume of 10 milliliters, which means that it has 50 milligrams for each milliliter. You can also find a bigger vial of 5 grams. It can be administered through almost every route, but in anesthesia we use intravenous or intramuscular. Now let's take a look at the doses, taking into account that ketamine is not used as a single drug, but combined with others. We said earlier that ketamine will produce sedation, analgesic effect, and hypnosis. The dose for sedation and analgesic effect is 0.2 to 0.8 milligrams per kilogram intravenous or 2 to 4 milligrams per kilogram intramuscular. We can also start an infusion of ketamine during general anesthesia to improve analgesic outcome. In this case, dose will be 0.2 to 0.8 milligrams per kilogram per hour. The dose for hypnosis or sleep induction is 0.5 to 2 milligrams per kilogram intravenous or 4 to 5 milligrams per kilogram intramuscular. With a single ketamine bolus, patient will awake in 15 to 30 minutes. As for adverse reactions, the most problematic and less wanted are the psychomimetic reactions, such as hallucinations, floating outside the body sensation, euphoria, or fear. These are more often seen in adults, particularly if they have a personality disorder. I'm sorry to tell you that the mechanism for which these reactions are produced remains unknown, but it is suspected to be related to an impaired vision and hearing nucleus function, which leads to an erroneous perception of the environment. The good news is that this effect can be prevented if we administer a low dose of benzodiazepines, such as midazolam, 0.1 milligrams per kilogram, 5 minutes before ketamine. Finally, contraindications. We have them both absolutes and relatives. Absolute is allergic or anaphylactic reaction to ketamine. Relatives are heart ischemia because it will increase cardiac output and its oxygen demand, endocranial hypertension because it increases endocranial pressure, open eye lesion because it increases intraocular pressure, patients with psychiatric disorders such as schizophrenia, and patients with pulmonary hypertension because it increases blood pressure of the pulmonary artery. Okay, that's it for today. Thank you very much, and I will see you on the next video.